Hey friends, hi. So, what is Materia Medica? A question that evolves in the mind of every person in this world who knows about homeopathy or who wants to know about the homeopathy. So, मैं एक अगर छोटी सी लाइन में उसको बोलूँ, होम्योपैथिक मटेरिया मेडिका क्या है? सो मटेरिया मेडिका इज अ बाइबल और मैं इसको गीता बोलूँ तो ज़्यादा बेटर है. इसमें जो भी लिखा है, जैसे भी लिखा है, जितना भी लिखा है, that is enough to treat many of the diseases around this world. Just looking at the symptoms, that is the beauty of this materia medica. मैं ये नहीं कहता कि इससे diagnosis would be changed, like if you have any known reports of any of the disease, of any of the critical disease or the crucial disease, but it can change the course of a medicine and the course of way of treatment, the course of treatment to make sure uh, patients will get cured in a better way without any pain and would get relief as soon as possible. Okay, so from today onwards, what we will be doing is starting a series named as Know Your Materia Medica in the form of ABCD. So, Homeopathic Materia Medica ABCD. So when I say ABCD, it does not mean that I will be giving you the medicine simply starting from A and will end it on the Z. So it will be pattern or sequence, like we will be starting with the basic core medicines in the homeopathic materia medica. Then we will move on to the ABCD from A to Z, covering all the medicines in the homeopathic materia medica. Then at the end of the series, we will be covering what is repertorization, how people do the repertorization, why is that important, and what are the some repertories are available in the market which you can use. Then at the end of the series, we will be giving you the keynotes of the homeopathy, which is basically a guiding principle. Okay, so let's start with the homeopathic materia medica. So you can find this literature, whatever I'm going to say, in at the LinkedIn page of HomeoON. So to hear this out, like and subscribe the channel HomeoON so that I can give you some more medicine and some useful study material for the homeopathic students and some useful keynotes or the key points on practicing homeopaths who basically started their practice. So LinkedIn page also named as HomeoON. So do subscribe to that channel also, or follow that page and subscribe the YouTube channel HomeoON also. Okay. So let's start. What is Materia Medica? Which is the first post. What is a Materia Medica? Number one post. So if I go by the definition, Materia Medica is the study of a medicines used in homeopathy and the symptoms. तो सरल भाषा में बोलूँ तो होम्योपैथिक मटेरिया मेडिका स्टडी ऑफ मेडिसिन है जो कि हम होम्योपैथ यूज करते हैं सिम्टम्स को पिक्चर करने में, जो कि किसी भी पेशेंट के साथ एसोसिएटेड होती है. जैसा मैंने शुरुआत में कहा, वी डू नॉट treat a patient on the basis of the diseases, the name of the disease. We treat the patient on the basis of the symptom. We create a picture of a patient based on the symptom that he possesses, and we try to make sure that he will be get cured with the help of the homeopathy. Okay. So moving on, think of it as a dictionary of remedies. Why dictionary? Because in Materia Medica you will find lots of medicines, and it is very difficult to learn each of them, but it is very easy to learn the symptoms because person to person, only thing which differs is the symptoms. So you just need to remember the symptoms. You do not need to remember the chemical formula you are going to use for any of the medicines. Okay, so it's very easy and very simple. So think of it as a dictionary of remedies, but instead of listing diseases, it describes the complete pattern of symptoms produced by medicine during proving and observed in clinical practice. So what is proving here? Proving is the live testing, but we do not do our homeopathic medicines testing on the animals. We love that. We do live testings on the human bodies, or the live human beings, because they are the subjects and they can tell us how are they feeling with that medicines, what are the symptoms that are changing, what are the modalities that they are feeling, and how this medicine is getting worked into their bodies. So it's easy to very easy to make sure that the medicine which is I'm going to prove is concluding, and it will help. So why Materia Medica is important? So point number one, it helps us understand the characteristic picture of a remedy. It includes mental, emotional, general, and local symptoms. It considers modalities, what makes a symptom worse or what makes any symptom better. It records the patient's individual symptom as a record, not just as a disease. It helps the practitioner to compare the patient's symptom picture with the remedy picture. So if I bullet point of all these is that ये हमें हेल्प करता है एक किसी भी कैरेक्टरिस्टिक रेमेडी को. So what I'm saying is that it helps us to understand the characteristics picture of a remedy. That means हमें ये हेल्प करता है कि हम किसी भी पेशेंट में पिक्चर कैसे करेंगे, उसे क्या हो रहा है, उसकी डिसीजेस को इग्नोर नहीं बोलता मैं, थोड़ा सा साइड में रख करके उसको क्या सिम्टम्स हैं उसका एक पिक्चर बना करके. जैसे हम घर बनाते हैं तो हमें ईंट पत्थर पानी कंक्रीट सब लगता है ना. सो अगर हमारे घर में कहीं कुछ होता है, कुछ टूट फूट हो रही है या कहीं कुछ हमको सीढ़न दिख रही है तो हम सीढ़न को जस्ट ऐसे ही आकर के पेस्ट नहीं लगा देते ना. हम देखते हैं कि वो कहाँ पर एग्जैक्टली सीढ़न आ रही है, क्यों आ रही है, उसको समझते हैं, उसे जानने की कोशिश करते हैं, तह तक जाने की कि आखिर ये सीढ़न क्यों आ रही है. और जब हमें पता चल जाता है कि सीढ़न आ रही है यहाँ पे इस वजह से आ रही है, तो हम उस चीज को ट्रीट करते हैं, ना कि सिर्फ एक प्लास्टर लगा कर उसको बंद कर देते हैं. सिमिलरली होम्योपैथी वर्क करती है, वो आप समझ पा रहे होंगे. फॉर एग्जाम्पल के लिए अगर मैं आपके साथ एक मेडिसिन शेयर करता हूँ, एक ट्रेडिशनल होम्योपैथिक मटेरिया मेडिका की एक मेडिसिन है जो कॉमनली यूज होती है अधिकतर फॉर द पेशेंट्स who have the who had or who has the left sided symptom. So when I say left sided symptoms, यानी कि complaints in the left part of the body, left leg, left eye, cheek, left cheek, chest. That is very crucial. Don't ignore it. Symptoms जो कि राइट से स्टार्ट होते हैं और लेफ्ट की तरफ. टाइट क्लोथिंग को इंटॉलरेंस रखने वाले लोग या फिर प्रेशर फील करते हैं कपड़ों में, मार्क टॉकेटिवनेस होती है और एक इंटेंसिटी होती है उनके एक्सप्रेशन. वो जो भी बोलेंगे इतना इंटेंसिव वे में बोलेंगे कि आप उनके एक्सप्रेशन से दूर से ही पहचान जाओगे कि बंदा गुस्से में है या शांत है. इतने अच्छे एक्सप्रेशन होते हैं उसके. सिम्टम्स जो होते हैं उसके सोते सोते ज्यादा बढ़ते हैं. कंप्लेंट्स हार्मोनल चेंजेस के साथ या फिर कंजेशन में बढ़ते हैं या रहते हैं. ये सिर्फ इनमें से 4 पॉइंट या 5 पॉइंट में आपकी लेकेसिस मेडिसिन से सामने, बट दीज आर द की नोट्स ऑफ द लेकेसिस. ये आपको किसी भी सिम्टम्स किसी भी ह्यूमन बीइंग को बेस्ड ऑन देयर सिम्टम्स हेल्प करता है आइडेंटिफाई इफ इट इज राइट साइडेड मेडिसिन, राइट साइडेड पेशेंट, left sided patient, left side modalities, left side disease symptoms, and everything which is happening moving from left right to left. So could be a lachesis person, but still we need to create a picture of it. We just imagine it right now. Okay, so that's the beauty of the homeopathic materia medica. We just do not picture it. We make a picture. We do not imagine it. How do we do that? Is with the help of the complete symptomatology of that particular patient. So, key principle of homeopathy: believe in the medicine, believe in the symptoms, do the complete case taking from top to bottom, right to left, left to right, and bottom to top. Because symptoms may vary from every each sides. I'm not saying four side, it's each side. Why? You will be shortly knowing into the next episodes of this Materia Medica ABC. So इस series में next medicine will be the complete picture of the Lachesis based on the bullet points, keynotes, and how we will be using Lachesis in the homeopathic Materia Medica. So do look out for this channel for the next episode, and thanks for hearing me out. And please like and subscribe the channel, follow the LinkedIn page for the study material, and for the listening, please follow HomeoON. Thank you so much.